Greetings, I'm Dr. Farzaneh Haratian, a psychologist in supervised practice at CPBAO in Ontario. Today I'm going to talk about integrative eclectic approach because I believe that individuals, they are unique, they have unique background and potentials and particular concerns, psychological distress that needs to be treated differently, and one method or one approach, something like a one-size-fits-all formula, would not be working appropriately with each individual. So there should be some particular method tailored for a certain concern that they are facing. Eclectic method is evidence-based, and it is employing combination of different therapies to come up with something that could be useful for psychological wellness and emotional stability. And in the clinic, I would use a CBT, a DBT, ACT, positive psychology, ERS, REBT, and also narrative therapy. And all of them come with different types of questions I would ask in the first session in order to know your story and the way you are looking at the challenges and struggles and the pains that you have. For example, if someone is struggling with a panic attack, I would start with CBT, cognitive behavioral therapy, in order to find the cognitive distortions or the negative, unhealthy thinking patterns that could be affecting their emotion and actions, or act in order to give them this opportunity and this belief that pain could be there and life is impossible without pain and distresses. We're going to accept them as they are. We're just going to be visitors and observers, and we're going even to make a space for them, but it doesn't stop us from moving ahead with our goals and with the values that we have in our mind on the path to who we want to be. Or I use DBT when I feel that is overwhelming, intense emotion that needs to be treated quickly. Then we would use some pragmatic and practical tools and some techniques like TIPP, temperature change, intense emotion, pace breathing, and PED, muscle relaxation, in order to help you and guide you on the path. And also REBT, it goes much deeper than CBT because it's not only about thinking patterns, it's about the shoulds and musts that needs to be changes to preferences, and there should be some changes in the way we believe that something is right. Maybe they are not, and then it needs to be altered, and then we need to go through some modifications in the way we think and we believe that it is true. And then also with narrative therapy, it's about externalization. You are going to distance and separate yourself from the problem. You are not the problem, and the problem even is not a part of you, but it has been just visiting you. So I might ask you, would you label it? How would you name it? And what has it done when it comes to visit you? What would you stop to do, or does it push you to do? And then we're going to find some ways in order to re-author or re-narrate it, and then make it as we want it to be. And the first initial sessions would be understanding your story, what it is, and then we would find the method and the technique and the approach that would fit that particular concern. We're going to check whether it is working or not, and we need to fix and modify some particular phases and steps. This is not only talking about the problem, but we are going to employ some strategies pragmatically and practically to tackle the issue. So I am happy to walk with you and give you the light that you need and the tools that could help you on the path. Thank you very much.